The Standards Committee has been hard at work creating a document that will help shape employee behavior and reinforce our 5 core values of compassion, humility, integrity, accountability, and respect. It's all part of the strategic plan Quest for the Best 2016, and their efforts will help guide the actions of our staff and volunteers and have a positive outcome for workplace culture, patient care, safety, and making the DRHC the best small hospital in Ontario. Hi, so we're here with Marlene Morgan. We're talking Standards Committee. Can you tell me what's going on? What's the story here with the Standards Committee? What are you guys doing?
Well, the Standards Committee was formed through recommendations of staff who could represent a wide, diverse group of people within the hospital, and to take a look at the values of the hospital and to try to get a sense from all members of the staff, physicians, volunteers, of the kinds of concrete behaviors that we would associate with specific values of the hospital, and develop some guidelines for the kinds of behaviors that we want to see exhibited by our staff so that we could make a commitment for great quality care for our patients, families, physician groups that we work with, and the community at large. We really want to meet and exceed the expectations that they have and really be consistent with our quest for the best.
Okay, so we're here with Laura Bergstaller. How are you today?
Good, thank you, Chuck.
So you got a couple of minutes to chat about some standards here?
Oh, a few seconds.
Yeah. So you may have heard a little bit about the Standards Committee and the 5 core values: compassion, humility, accountability, integrity, and respect.
Of course, I've heard of them.
Is that right? So we're looking. We've been running around and chatting with some people about how they showcase some of those core values here. Now, word on the street is you're the princess. You're the queen of telemedicine. Do you want to discuss or refute that?
I would have to refute that based on the value of humility. I have to say there are 3 members of our department, and we all work very closely together, not just with each other, but with other departments around the facility and outside of the facility. So none of us rank above each other. It's always, always a team effort.
All right. I think you have shown the core value of humility. Thank you.
Thank you.
Thank you, Dr. Gagnon. Thank you, Dr. Moyer, for joining us here. We're talking about the 5 core values: compassion, humility, accountability, integrity, and respect. We're down to respect here, and just wanted to capture your words, so try it off the top of your head.
The core value of respect. To be able to listen and appreciate whatever the other person is saying. But if you want to know about respect, you got to go see the Karate Kid with Mr. Miyagi. He's going to explain it all to you by telling you you start at 100%, and after that, it's what you do. We'll decide whether you stay at 100%.
So what Dr. Gagnon says for respect is he makes his medical students wax his car. Wax off. Wax off.
Do or do not. There is no try.
Yeah, I think Dr. Gagnon, as usual, has sage advice about respect, and I think we all, one of the things we talk about is respecting mentors in our hospital, and we actually have great mentors, so the respect that we do have in our hospital has been established by a group of mentors who have worked here for more than a few years and have passed those values on. So,
like that guy?
Like this guy, yeah.
I know. Okay, thank you.
All right.
Hello, Dawn Armstrong. How are you today?
I'm great, Chuck. How are you?
Good, thanks. So we're talking standards, and you're on the committee, correct?
That is correct.
All right, so we get a couple of questions. We're trying to get everybody on board with what we're doing and letting people know about the work that you guys are doing. So I got a couple of questions. First question is, this is a tough one. You're on a desert island. You can only take one of the 5 core values with you, and they're compassion, humility, accountability, integrity, and respect. Which one would you take and why?
I would pick integrity because I'm on a desert island, and integrity is doing the right thing when nobody else is looking.
Where did you come up with that?
Right off the top of my head.
That's a fantastic answer. So, Penner, how are you today?
Very good.
Listen, we were thinking the other day, kind of a hypothetical scenario. I want to get your thoughts on this. We were wondering if aliens were to abduct you, and while you're up there in that spacecraft and they're probing your body, they're questioning you. They want to colonize another planet based on one of the 5 core values at the Dryden Regional Health Centre. Which one would you tell the aliens would be best to colonize their planet? Like, you want everybody to sort of have this core value. What would it be?
Excellent question. And I've, when you ask me like that, it gives me sort of the off-the-cuff response that it would have to be compassion. Because on, let's say, a different planet, one of the reasons that makes life sometimes worth living is having the ability to empathize with other people. So to have emotions, to have feeling. And without feeling and emotions and being able to connect with other human beings on that level, it would make life not as much worth living. So compassion is all about the ability to be able to connect with people emotionally. And so it's true in a medical environment, we have to work logically, sometimes remove ourselves a little bit from our emotions to do procedures and to do work, but actually at the same time, it's really important to not lose touch with how we feel about the things that we're doing. So when we're working with our coworkers or working with patients or clients, the reality is if we're able to connect with people a little bit, not just cerebrally, but also with how we feel, then I think it takes the quality of the work that we do to a whole another level. So on another planet, to experience interacting with people that way, it would make that planet a better planet in the universe.
Good morning. We're with Corey Trist from the IT department. How are you today, sir?
Not bad. How are you?
Good, thanks. We're talking standards and core values, and this is a pop quiz. What are the 5 core values, Corey?
5 core values: respect, integrity, humility, compassion, and accountability.
5 out of 5. Perfect score. Of those 5, which one do you think you most closely identify with or exemplify?
I think we identify with all of them continually. The closest for me on a daily basis, I would think, would be accountability.
And why do you say that?
Because I feel like I am held accountable to a lot of people here at DRHC. There's a lot of programs and services that we run that depend on our IT infrastructure and knowledge to happen.
If the standards, compassion, and humility were to wrestle, which one would win and why? Here with Brenda Schmucker, we're talking standards committee work. How are you?
I'm fine.
Good. So why is the DRHC putting the standards committee together? What is it that you're trying to accomplish?
Well, I think we really wanted to take the values that we've had for a long time, and we wanted to put them on paper with some ideas of what they really mean, and that's where the I will statements have really been helpful, because it helps people to look at them and know what we're thinking of when we say that our standard is compassion or humility or...
Afternoon, we're here with Sherry McMenemy, and the appropriate backdrop here for our interview: when you're in transition, be patient and accept uncertainty. Did you put that up there for me? All right.
For everybody.
Perfect. So we're talking a little bit about the standards committee work, and I'm hearing things about the I will statements. Can you tell me a little bit about what that is?
So the standards team has specifically spelled out behaviors that everyone in the organization is required to practice. The I will statements are everyone's individual commitment to model daily actions that demonstrate our behavior standards.
All right. So this isn't, the I wills aren't really something that is brand new and everybody has to start doing. These are probably things that, are these things that people are already doing, like on a daily basis?
I think most people are probably doing these, modeling these behaviors anyway.
Yeah.
So yeah.
Oh, good. Okay, well, thank you for your time. Hello, we're with Doreen Armstrong-Ross. How are you today?
I'm fine.
Good. So we're talking about standards.
Well, the standards provide a playbook to every employee in the organization that will help achieve and sustain our organizational goal.
And our core business is patient care, so this is going to improve outcomes for the people that we're we're serving.
It does.
Ultimately.
It does do that, and it also improves the working environment for our employees. So anyone coming in here, patients, visitors, physicians, our staff, we want them to feel an environment that is, that meets our values, is respectful, is compassionate.